So good morning and sorry for inconvenience. This is regarding what we should find ourselves and be practical while putting trifocal and EDOF lens. So how do I choose between trifocal and EDOF? See, where you are practicing, that counts much, and how patients are dealing with and how to counsel the patient is a main issue where I am practicing. It's an urban area, but we called it as a uh, counseling area. Has to counsel from monofocal to trifocal, from trifocal to EDOF. So this is what simply choice based on the needs. My experience is happy and satisfied. Both are same, but there are two different things because happy patient will always bring happy patients and again he bring another patient. Satisfied patient will say, next time, is it necessary that we have to put same lens for another eye? Happy patients, patient who no longer desire to wear glasses, housewife, elderly and retired patients. This is my main issue, that unhappy patient, patient with young age, especially teachers who ask so many questions and they will eat your head after explaining everything. Googlers, these are the biggest issue nowadays because whenever we are going to explain them regarding the lens, they will just start their laptop and start with Google and first they will say, sir, trifocal is best, don't put it off. So this is the unhappy patients and their relatives. Drivers, especially in night driving, not accepting the facts. Patient with higher expectations. This everyone is facing the problem when patients are having higher expectations and their expectations are beyond our limit. So when limits are there, their limitation starts. Patient not willing to operate other eye. Because whenever we are going to counsel them that very soon you have to get operate for another eye also, they are not going to do that. As we are always ready for refractive surprises, the addition plus one diopter or minus one diopter, even after counseling the patient, the demand, they always demand for near. This has happened with me so many times. Because when patients are going to discuss with another patient, he will say, because where we are standing, where patients are from, and where you are practicing, that is more important. As patient need to know that neuroadaptation take longer period and patient dissatisfaction is directly proportional to preoperative expectation of patients because their expectation are too much because as you are counseling them for this type of lenses, so we are taking their too much time and they think that why doctor is forcing to get this lens for their eyes. Rule of counseling for trifocals, what we are doing, that we should know that total independence from glasses may not be achieved. This is the first time when patient are asking, patient, Chashman, are we going to have specs? We have to say, no, no, you have to have some sort of refractive error that has to be there. Good light is required for reading because sometimes patient may take a little bit dimmer light or in the dark he wants to read and there he finds some problem. Glares can be expected at the time of night driving. Neuroadaptation may take 2 or more months. Binocular surgery is preferable as it helps in neuroadaptation. This counseling has to be done before going to for trifocal lenses. What to communicate to patient? It is very important to clearly communicate to patient that when patients are coming for EDOF, EDOF is not a presbyopic correction refractive IOL. It is an advanced monofocal which will give uncompromised distance vision along with good intermediate range of vision. EDOF are preferred over multifocal trifocal in eyes with maculopathy, irregular corneas or glaucoma. Proper patient counseling and understanding the patient need is important as it is a setting realistic expectations, especially with regards to possibility of needing regarding glasses as well as the occurrence of same glare and halos. It will be easier to prudent ophthalmologists to propose an EDOF to their patients. And much more important is both are different lenses, trifocals and EDOF are not interchangeable. When EDOFs are available, but my choice for trifocal is in this patient. Why am I saying this patient? This is a trifocal patient, and you can see the patient is reading, both I operated, and patient is seeing that she can read distance also and for near also. Everything is all right. Nothing is different. I'm just explaining her, you are absolutely fine, sorry. You are absolutely fine. Patient here, when the EDOFs are available, but my choice is trifocal for this patient. Because I have seen when I had put EDOF lens in my optometrist eye, and I explained, I asked Saurabh also regarding the same. The lens I'm going to talk in the discussion, the patient is accepting minus 1.5. That is the EDOF lens, and he is an optometrist, and he is very close to me. Now, how to explain that he is driving in night also, day also, so I thought I should put EDOF lens for him, and that is the problem, and this has happened with me with EDOF also, but somehow I prefer trifocal in such cases if you can't, because when you are explaining for the EDOF, patient want it, it's okay. You can accept for near vision, at least +1 and all. But he don't accept that he wants to wear minus 1.5 for the distance. And patient, even after explaining, I am having AIOS2025 700, 2-3 scans have done, and after that also, patient is very unsatisfied, and he is still eating my head. And when I'm going to ask him, like now we have to do another eye, still a question mark. Are we going to put the EDOF? So this is what the patient motivate to reduce the dependency from glasses. Presbyopic patient without cataract is also preferable for trifocal. Hypermetropic patients are easier to please as compared to slight myopic patient. Bilateral implantation candidates are more preferable and easy to please. Patient is ready to have second eye operation as early as possible, and affordability of the patient, that is more important, and that counts. Now again one more explanation for this patient. Why I'm taking this patient is a trifocal, Indian trifocal lens I used. She is using the first line, that is N6 for near, and for distance also she can read 6/6 without specs. Now you can see it, actually it's in Marathi, but the thing is that she can read. But now after 1 month, she came to me and she asked me, doctor, why you had not given specs to me? Because a lady who is staying side to me, because they are from the village area, they were asking, like, you have not given specs, you should wear specs, otherwise your lens will fall down. So this is what is the problem while counseling the patient. And when you are going to counsel, the patient selection is more important. Thank you. Thank you. Thank you very much.
Thank you, Dr. Shon.